So I think my initial approach to the idea of nursing philosophy prior to beginning the program was based largely on the vague and very broad idea of wanting to impact someone's life in a positive way on whatever scale I'm able to do so. Not always necessarily resulting in a happy outcome, but in the best possible outcome within a situation. The things that I've learned just in starting the program, I think have helped narrow down that philosophy and expand it in other ways. So my background is very science-based. So to me, logic and science make sense. Critical thinking and evidence-based approaches are going to be, I think, very easy for me to fall back on. Where I need to work on my own personal approach is my interpersonal interactions. So with regards to autonomy, I think I'd already imagined myself as one cog within the machinery of the entire medical system, but also one cog within the specific machinery of a patient's time with us. What I need to work on, and I think what the program is starting to help me see, is my specific role within a collaborative approach. I knew that I'd be part of a team. I knew I'd be working with others, that I'd have very specific tasks that I'm capable of and asked to perform, and others that I'll have to rely on people with different training, different knowledge, and different abilities. So what I think is very important to keep in mind, and I don't think it'll be a problem for me, is don't come into this with ego. I personally don't have much of an ego. I'm more than happy to say I don't know how to do something and ask someone else how it should be done best. So I think that will be a key aspect to work throughout my nursing career, is no ego, just heart. Do this with the needs of the patient in mind and not with the personal needs of feeling your ego stroked. I think the two traits most easily associated with nursing in my brain are advocate and caregiver. The caregiver aspect is a given. I think that's what we all see a nurse as. But I think being a voice for the patient as well in an advocacy role is really important to keep in mind. The key roles in making nursing collaborative are both being a communicator and an educator, communicating with colleagues, communicating with the patient, and also educating myself and the patient and the team as well. Those things are not difficult, but they are going to require a lot of time and effort. I think the best thing about the managerial part of nursing practice is that it really draws together all the elements of a holistic approach. You understand that nursing is going to have so many different elements for you to pull from in order to help the patient to the best of your ability. But in managing and in going through the different foundations of nursing, it helps you see how many different hats a nurse could wear. So you are a medicine provider, a friendly ear, a helping hand, a hug, and sometimes an educator in the kindest way possible, sometimes a hard ass. But these are the things that you need to do to different degrees. And the important thing about all of this, I think, would be maintaining an underlying system of heart and caring. You want warmth to be felt by the patient in everything you do, even when you need to remain aloof and professional in some ways. I would like my patients to always know that there is warmth and caring driving every choice I make, and that it's for them, so that regardless of how professional I can be and how I'll match my formality and my approach to make them comfortable, they'll always know that I want what's best for them and that they have a voice in deciding that along with me.